Are you one of those moms or women that criticize other women for delivery through cesarean section? Or you are not proud of being a cesarean mom due to what people say, due to the criticisms and stigma in the society? My dear, cesarean section is not your fault. Hello everyone, welcome back again to my channel. How you guys doing? I hope you're fine and you're doing great. Okay guys, today's video is inspired by one of the series I watched yesterday. It gets to me. It's like I have to do this video to share this awareness, to tell people that cesarean section is not anyone's fault, guys. So the video, I will show you the clip of the video. You will know it, although it's in Hindi, but I'll try to explain it to you what the lady was saying. So guys, just watch the video. I will get back.
डॉक्टर कह रहे थे कि किंजल का ब्लड प्रेशर एकदम से अचानक बहुत बढ़ गया है, तो ऊपर से वो कमजोर भी है, तो ऐसे में नॉर्मल डिलीवरी अगर करने की कोशिश करेंगे तो उसके और बच्चे की जान को ऐसे खतरा, तो उनके ख्याल से सिजेरियन करना चाहिए।
ये सब चोचले इनके पैसे कमाने के बहाने।
मेरे हिसाब से किंजल की नॉर्मल डिलीवरी नहीं होनी चाहिए, वो झेल नहीं पाएगी।
हमारे जमाने में ऑपरेशन कुछ नहीं था, तो क्या तब औरतें वो बच्चा नहीं पैदा करती थी बा, लेकिन उस वक्त अपनी जान पे खेल के दर्द बर्दाश्त करने के अलावा और कोई रास्ता ही नहीं होता था उनके पास।
So guys, after watching that clip, it gets to me. I was like, so people still think this way. Because in one of my videos, I clear about the myths and misconception about cesarean section. You guys should also please do check it out also, because I'm going towards sensitizing women about this cesarean mentality, because the mentality of cesarean section in the society is becoming alarming, guys. Only Vickyscornerr inspired me to also do this video, because she, in one of her video, she mentioned a lady who lost her child, and this could have been prevented if cesarean section has been done earlier. So today's video, I'm going to share with you guys 10 common reasons why cesarean section is being advised or is being recommended. And if you're cesarean section mom, feel proud, because it's not your fault. Cesarean section is not your fault, my darlings. Medical reasons, I will categorize it into two. The first one is planned, and the second one is emergency. And I will tell you why it is planned, the reasons, and I will also tell you the reasons for emergency. So let's start with the planned one. The planned cesarean section, the first one is abnormal position. In this case, the position of the baby matters. Some babies have breech position. In this case, the buttocks is down. Normal delivery has to be done when the head is down, but in breech position, the baby's buttocks is down and the head is up. And another one is transverse position. In transverse, either the hands or the legs are downwards and the head is somewhere else. Okay guys, in my own case, it's transverse position. Well, once the doctor said you have to go on the cesarean section, I smile and look at my husband, because I know it's for the betterment of my child and for myself. So guys, if your doctor said your baby is not in a good position, it's abnormal position, you have to undergo cesarean section, please take attention, pay attention and take her advice. So guys, that's number one, abnormal position. Another planned cesarean section, the reason is the size of the pelvic. The women pelvic is too small. Some women have cephalopelvic disproportion, or the pelvic is too small. In this case, this pelvic of the women, the cervix is too small. It's too small to let the baby to pass through it. So in this case, the healthcare provider will advise you to go for cesarean section for the safety of the baby and the mother, to avoid further complications. So cephalopelvic disproportion is another reasons why cesarean section is also prescribed. Guys, the third reason for planned cesarean section is the position of the placenta. Sometimes the placenta hangs below the cervix, and this condition is called placenta previa or placenta abruption. Guys, you must have heard about it. Your doctor myself told you about this. And if going through, it can cause some serious bleeding during the birthing process, and it can also block the pathway which the baby will come out, and which will cause complications. So in this way, in this process, the only option is for cesarean section. So placenta previa or placenta abruption is common reasons why a doctor prescribe tells us. Another condition is, another reason is previous cesarean section or previous surgery. Although lots of women after giving birth through cesarean section can also go through vaginal delivery, but in case there are some complications, maybe the position of the baby or the position of the cervix, and you have done severe cesarean section before, the doctor will also tell you that you have to undergo cesarean section, or some surgeries like uterine invasive or some invasive uterine surgeries. When you have done some surgeries in the uterus or invasive surgeries, the doctor will ask you to go for cesarean section delivery instead of the normal delivery. And another one is multi-pregnancy, like the triplet, quadruplet, or more babies. Some women can deliver normal with triplet, with twin, but some cases when the baby A is not lying in the good position, and baby C or baby B is not lying in a good position, and it's a twin or triplet, this will make the doctor to say you have to undergo cesarean section. So guys, if you're carrying twin, you can still deliver through normal, unless there is chances of, or there is reasons why you cannot go through normal, then you can go through cesarean section due to many factors like the position of the placenta or position of the baby. So guys, this is another reason for medical for why cesarean section is being done. So guys, another one is if the baby is larger than average, cesarean section is also advised. If the baby is larger and can't pass through the cervix, cesarean section is also advised in this case. And another one is birth defect. There are some birth defects that can have a risk on the baby as well as the mother, like the congenital heart diseases. This might have a high risk of delivery vaginally. So in this case, cesarean section is advised. Another important one, and it is common, is medical conditions. Some medical conditions, some women suffer when they are pregnant, like they suffer from high blood pressure, they suffer from heart diseases or diabetes. In this case, if you deliver vaginally, it might be too difficult for both the mother and the baby. So it is recommended by the doctor to have a cesarean section due to your medical conditions. So guys, that's it for plan. We will go now to cesarean section, emergency cesarean section. Why we need to do emergency cesarean section. The first one for emergency cesarean is prolonged labor. When a first-time mom is undergoing labor for more than 20 hours, or a woman who has delivered before is undergoing for labor more than 14 hours, this condition is known as stalled labor or failed to progress. In this case, the cervix refuses to open, and the more you wait, the more the danger it will cause to the baby as well as yourself. I've seen lots of women, they want to, because they want to deliver like the Hebrew women, as others might say, they will be in labor for more than 20 hours, suffering themselves, while the doctor said cesarean section is the best option. So in this case, prolonged labor, emergency cesarean section is advised, guys. So guys, another condition is fetal distress. When the baby is not receiving oxygen as it's supposed to receive, the heart rate begins to become abnormal, and if emergency cesarean section is not taking place, something might happen to the child. So it is advised that if a child is having fetal distress, the child is not breathing very well, it is advised to have cesarean section. In this case, you have seen that it's not anyone's fault. So guys, fetal distress is one of the reasons why cesarean section is advised. Guys, the next one is called prolapse. And this cord prolapse is a serious medical condition that occur when the umbilical cord falls below the cervix before the baby is even born. And in some scenario, you will see the umbilical cord wrap around the neck of the baby, and it can choke the baby, or sometimes it cut off the oxygen supply to the baby. And if immediate action is not taken, it can lead to serious complication or even death of the child. So cord prolapse is a common reason that's why cesarean section is being guys. The last one, the 10th one, is placenta obstruction. An emergency cesarean section is required if the placenta begins to separate from the uterine wall, which can lead to deprivation of oxygen to the baby. So in this case, cesarean section is a must. There is no doubt that cesarean section are important medical procedures that can save life and prevent serious complication in both mother and child. Guys, with these few points that I listed, I hope I've been able to convince you that cesarean section, it's not anyone's fault. It's not your fault. You didn't go for cesarean section because you're a lazy mom or because you're less of a mom. There are some medical conditions that will determine if you go for vaginal delivery or normal delivery. So tell me in the comment section if you're a proud cesarean mom and some of the reasons why you have undergone there, or you're also being criticized also by the society or friends or family for undergoing cesarean section. Guys, I hope you enjoyed this video, and please, if you do, please don't forget to give me massive thumbs up. It helps my channel to grow. Thank you so much. And if this is your first time watching this video, if you're coming across this video for the first time, please do well to smash the red button, subscribe guys, please, it means a lot to me, and turn on your notification bell so that I can be notified anytime I post a new video. And for my returning subscriber, thank you guys for always watching my video and for showing your love and support. Guys, remember I also did a video about the conception about cesarean section, the means about cesarean section. I cleared the air. Please do well to check it out. I'll be attaching it on the screen. Please do well to check it out so that you'll be clear about misconception about cesarean section and everything about cesarean section. You can be also be clear about that. So guys, I'll see you all in my next video. Stay tuned for my next video. Stay fabulous as always. Bye bye.